Hello and welcome to this online introduction to sensory integration, and thank you for joining us. So we are occupational therapists from the Community Learning Disability team in Sheffield. You will have been asked to watch this presentation because you or someone in your life has been referred to our team. It is possible that you or the person you are supporting has some difficulties with the sensory world around them. And this means that you struggle to do things you want to do when you need to do them. This video will explain what sensory processing is and how it can affect people. After you have watched this, we will send you a link to a short questionnaire that you can fill in, which will help us understand what your difficulties might be. We will then be able to send you some information that should be able to help you. We will also contact you about 1 month after we have sent the information to check how things are and if you have been able to try some of our suggestions. If you are still finding things difficult, we may be able to offer you some more support. So it is really important that people have a consistent routine. If you don't know where you are, who you are with, or what you are doing next, you are going to end up confused and stressed, and other interventions are going to be difficult to implement. People need to understand what is happening, and this needs to be communicated at a level that the person can understand. Changes do happen, but when they do, they need to be prepared for and communicated in the right way. There is no point having a timetable up with staff's photographs on if the photographs are wrong because someone had to go home sick. A timetable will be different for different people. Visual timetables are useful even if people can read, as they are a quick and easy to digest way of providing information. When someone is anxious, their understanding of what is being said to them, both in writing and in words, decreases. Staff and visitor photos are also useful as it can be difficult to remember everyone's names. A timetable will easily show what is about to happen next. It can be on a written piece of paper, on a whiteboard, or board with Velcro attachments, on a phone, or whatever works for the individual. It can be as simple as now and next, a picture of what is happening now, like having breakfast for example, and what is happening next, such as maybe cleaning your teeth. It is important to always use the same pictures and words to mean the same thing. So decide whether you write school or college, or the name of the particular school or college. That's an example. Or whether to use a picture of the entrance to the college, or the logo, or the room where they may go. It's very important to bear in mind that you must do this before anything else. If you don't sort out somebody's routine, then all of these sensory strategies just won't work. So sensory processing is the way our brain interprets and responds to input that comes through the senses. It's not about how well someone's senses work on the outside, if they need glasses or hearing aids, for example. It's about what our brain does with the information from our eyes and ears and from everywhere else. So a lot of people with learning disabilities also have autism, though by no means not everyone. It is now recognised that most people with autism have some sensory differences, and this is now one of the diagnostic criteria, so one of the things that is looked at that indicates that the person has autism. Not everyone with autism has sensory difficulties which cause major problems. Similarly, not everyone with sensory difficulties have autism. Anxiety can be a major influence in the extent of the difficulties. If things are unpredictable and there are changes in routine, then this is likely to increase anxiety, even if the people without autism. Anxiety will increase sensory difficulties. For example, when I am calm, I'm able to concentrate well, even if there is a lot of noise or background music. However, if I'm having to do a difficult piece of work with a short deadline, my stress levels increase and background sounds and music become quite irritating, especially if the background music is atonal electronic music, which my husband likes. At this point, I need everything to be quiet, even though 20 minutes earlier I might have been quite happy to have the music on. I'm very able to communicate the need for quiet, even if my levels of polite conversation may have been reduced to turn that music off. If someone is less able to control their environment and communicate, however, the increased levels of adrenaline caused by the anxiety are more likely to come out in negative behaviours such as hitting or maybe even self-harming. So, what are these sensors? So we have sight, hearing, smell, taste and touch. We're all familiar with these 5 basic senses. It's likely you know something about how they work. With sight, light comes into our eyes and hits the retina at the back of the eye. The cells in the retina turn the light into cells. The nerves that carry the signals pass through different areas of the brain and connect with other nerves. As it passes through different parts of the brain, the information gets split into different parts, filtered, combined and compared before coming through in a part of the brain called the visual cortex, where an image is constructed. The brain then works out what to do with the image. It recognises it is a bull running towards you and tells your body to run to the nearest gate. This is all happening all the time with all our senses. All the time, sensations are coming in from our eyes, ears, noses, skin, and our brain is getting all that information and sorting it, working out what is important and letting us know what to concentrate on. If we get a midge bite at the same time as the bull is chasing us, we probably won't notice it particularly, as our brain is telling us to just get out quick. There are also 3 additional senses that you may not be as familiar with, although we do use those every day as well. They are vestibular, so our sense of balance, proprioception, our sense of body position and space, and interoception, our sense of what is going on inside our bodies. We will now look at each of these in a bit more detail. So vestibular is our sense of balance. The sense located in the inner ear and detects the movement of the head, whether we are moving backwards, forwards, side to side or rotating, as well as whether our head is the right way up. One of the main ways of sensing movement is through structures in our inner ear called the semicircular canals. These are 3 tubes which face in different directions. The movement of fluid across hairs in these tubes tell our brains that the head is moving. The vestibular senses helps us control our balance, coordination and spatial awareness. If you've ever had an inner ear infection, you will understand how difficult it can be if your vestibular system doesn't work properly. Next is proprioception. Proprioception is the sensory system that tells us where our body is in space. Try to do this. Close your eyes and touch your nose. Did you manage it? You almost certainly did. You didn't find your nose by looking or by touching your face and feeling all over it to find your nose. You just put your finger directly on your nose. The sense that told you where your nose was is the sense of proprioception. This information that is picked up from your muscles and joints. The information can also come from the stretch in your skin. This sense tells us where our feet are so we can walk, where our hands are so we can pick things up. We need our sense of proprioception in order to be able to move skillfully. Proprioception will also let us know how to use the right amount of force or pressure. This is what helps us pick up an egg without breaking it, or use enough force to lift a heavy object. Proprioceptive input can also be provided by applying weight or pressure, for example by carrying a heavy rucksack or wrapping yourself tightly in a duvet. Proprioception and the use of deep pressure are powerful tools to help keep us really calm. It can also override other sensations. For example, rubbing the spot where you have been banged your knee does help with the pain. Dr. Temple Grandin, who was diagnosed autistic at the age of 3, states that occupational therapists have observed that a very light touch alerts the nervous system, but deep pressure is relaxing and calming. Temple Grandin worked in animal behaviour and observed that cows that were held in a squeeze shut when being inoculated calmed down. She invented a squeeze machine that helped her when she became overstimulated. This machine provided deep touch pressure across her body and helped reduce her anxiety and calm. Last is interoception. So interoception is another sense that tells us what is going on inside our bodies. This covers things like a sense of hunger, thirst, feeling full, needing the toilet, itching, feeling hot or cold, and so on. These are receptors located throughout our bodies in our organs, skins, muscles, and so on, which gather all this information and send it straight to the brain. For example, there are receptors in the wall of our bladders that tell us that our bladder is stretching because it is full and therefore we need the toilet. Not as much is known about interoception as the other senses. It is more difficult to change things, but strategies such as mindfulness can help. Using heavy work and deep pressure activities, proprioceptive activities can also be useful. So We all have sensory preferences, and these are all going to be different. Some people's houses are very plain and simple, for example. Other people enjoy having lots of pictures on, lots of knickknacks about, books or patterned wallpaper. Some of us love going to places such as Alton Towers. Other people start to feel ill just thinking about going on a swing. However, we can all choose what to do and communicate these clearly about why we don't want to do particular activities. Our sensory preferences can change according to what we are doing, our alertness, mood or stress levels. We might enjoy going to a very loud concert when we feel relaxed and like the music, but we might get very stressed if people are talking loudly in an open plan office, for example. Sensory preferences are normal. We tend to choose activities and surroundings that fit in with our sensory preferences. We also use sensory activity to help us, like snuggling in a blanket on a sofa to relax, or chewing pencils and tapping fingers to keep us alert. So everybody responds to sensory information in very different ways. It can become a difficulty if it infers with the person's ability to live the life that they need and want to. So that we can participate in important activities of our everyday life, it can also be a problem if someone is responding to sensory information in a way that other people can't understand. For instance, some people wear ear defenders to be able to cope in noisy situations. This is a good coping strategy. However, in some settings, some people find wearing ear defenders unusual because they don't know why they are needed. People can struggle to wear face masks as they cannot cope with the sensation on their skin. Their tolerance may change from one day to the next. People have difficulties with vision and light for a number of reasons, as well as sensory processing difficulties. It is always important to have an eye test to rule out any other problems. These can be carried out even if someone is non-verbal. People who avoid visual stimulation may prefer the dark. They may cover their eyes with their hands, keep their hood up, or wear dark glasses. They may prefer plain plates, clothes and walls. Crowded places where there is both a lot going on visually and movement, so things change, can be particularly difficult. People who are under-responsive to visual stimulation may not notice a lot of what is going on around them. They may not notice if someone comes into the room, struggle to see contrasts and the edges of shapes, and may be slow to respond to visual information, and therefore not avoid obstacles in their path. If someone is hypersensitive to taste, they will avoid strong tasting foods. They may well eat a restricted range of bland and predictable foods, often like a beige diet. Those who are hypersensitive to taste may not notice or react to strong tastes. People seeking taste are likely to want stronger flavours in their food. They may add extra sauces to all their food. They also can lick objects and use their mouth, and may not eat certain food items. Smell. So a lot of what we taste is actually us smelling the food. So smell is very closely linked to the memory, as areas of the brain that deal with smell and memory are very close together. That is why a smell can bring a memory back for a person or an event very vividly. If someone is not able to communicate what they are smelling or what they feel about it, it can sometimes be difficult to work out to them if there is an issue. Someone that you work with may be unable to tell you that they can smell things that you are unaware of. Someone who is hypersensitive to smell may like bland foods. They may dislike the smell of washing powder, so suddenly refuse to wear clothes that they previously liked because the detergent has changed. Petrol stations and shops like Lush, for example, can be problematic because there's obviously a very strong smell in. They may react differently to people if they are wearing perfume. Someone who is hypersensitive may not notice or react to strong smells at all. They might not notice their own body odour or the smell of food that has gone off. Someone who seeks smells may routinely smell non-food items. They may smell the hair of other people, for example. They may choose strong perfumes or toothpastes. Some people who seek smells can eat non-food items or smear feces. Next, on to auditory. Is it important if someone has auditory difficulties to check that this is not because of illness or hearing loss? People who are hypersensitive are likely to avoid noise. They may respond negatively to loud and unexpected noises and be aware of faint sounds that other people might not notice. The sound of fluorescent light is one example of this. They are likely to avoid noisy places and cover or plug their ears. They may try to drown out unwanted noise with predictable, pleasant noise such as music or white noise on headphones. They may be unable to concentrate if there is background music. If someone is hypersensitive to sound, they may not respond to their name or what people are saying. It may take a long time to process this information, and if a request is repeated, they may need to start processing it again. Someone who is seeking auditory input may need background noise or music to be able to concentrate. They may like busy places, like materials that make noises or crunchy foods. They may also wear headphones to listen to music. Touch. People who are hypersensitive to touch are also known as tactile defensive. Unexpected touch can be painful for some people. They may act emotionally or aggressively towards touch. Personal care may be difficult, with the feel of water, toothbrushes, flannels, and so on. And the pull on hair and the feel of stray hairs may be tickling. Certain clothes or labels in clothing can also be problematic. Someone who is hypersensitive to touch may have a decreased awareness of pain or temperature. They may not notice when they have been touched, or may not be aware when their hands or face are messy. Someone who seeks touch may touch or fiddle with objects. They may seek out touch, hugs and massages from people. People can look like they are both avoiding and seeking touch. Light, tickly touch can be very difficult for people, but deep, pressure, firm touch is much easier to cope with. Unexpected touch is likely to be particularly problematic, but if people are aware of what is happening or initiating the touch themselves, it is much easier. It is similar to the difference between being tickled and trying to tickle yourself. When you tickle yourself, you're able to predict exactly what is happening, and so you do not respond in the same way. Vestibular, or movement. With the sense of balance, the vestibular sense, people are responding to the movement in their head. With vestibular problems, it is important to rule out other reasons that a person may be having difficulties, such as neuromuscular conditions or an infection. If all of those are ruled out and there are still movement difficulties, the person may have vestibular problems. If they are hypersensitive to vestibular sensation, they find activities where the head moves difficult. They may dislike swings and roundabouts, not be uncomfortable when they are moved, for example, on escalators, lifts or hoists. They may not like their head upside down, for instance, when washing their hair over a sink. Someone who does not register the movement information well may well tire easily, having weak muscles and slump when sitting. If they seek the sensation, they may well be on the go all the time, rocking or spinning, and struggle to sit down for meals or tabletop activities. Proprioceptive. Proprioception is the sense of where your body is. It comes from the movements of the joints and muscles. You can't be over-responsive or hypersensitive to this sense. However, people can have poor body awareness and not get information from their joints and muscles to be able to move smoothly and skillfully. They may bump into objects as they walk or collapse into chairs. They may not be able to gauge how much force to use for an activity, so pinch or grab when trying to grasp, or not be able to eat a donut without the jam squeezing out of it, for example. People can also seek proprioceptive information to help them to be able to use their body better. It is also a very calming sensation and can override other sensations that people may struggle with, like light tickly touch. People who seek proprioceptive sensations may squeeze into tight spaces or wear tight clothing, or have spurts of running or enjoy other movements. People often have a mix of sensory difficulties. Alongside other problems they may have, such as communication. People's sensory responses can vary throughout the day and from day to day based on tiredness, illness, stress levels, and so on. For example, if someone with an auditory sensitivity need, they may need to wear some ear defenders for the whole day one day, but then they may not require them the next. Sensory difficulties affect many areas of life, and often what we can see is the difficulties that they can cause in day-to-day activities. We are briefly going to discuss some of these and the behaviours that you may see that could indicate a sensory problem. Oral motor behaviours are those to do with the mouth. In the mouth, a lot of sensations come together. There are taste and smell, but also touch, with the feel of food and liquid, the lips, tongue, teeth, roof of the mouth, and so on. There is also proprioception. The tongue is a very skillful muscle, and the jaws also do a lot of work when someone is eating. The mouth is also very sensitive. Mouthing objects is putting things into the mouth but not actually eating them. It is a good way of understanding more about the objects and getting tactile input. It is also a comforting sensation and many people use this sensation, for example, chewing pens, chewing gum or smoking. Chewing, where you add in the hard muscle work, can also be calming. Licking will also give a high degree of sensory input. Pica is eating non-food items, which can be anything from paper to cigarette butts. Biting can give a lot of proprioceptive feedback. If a person bites themselves, it will also give tactile and pain feedback. Overfilling the mouth can be an indication that a person has poor proprioception and they are not getting the feedback from the mouth that there is a significant amount of food in there. So hair washing can be problematic due to the movement involved of the water and the feel of on the face or the stray hairs tickling. Haircuts also leave tiny bits of hair on the clothing, which can be irritating and distressing that sometimes people may not be able to wear the same piece of clothing that they are wearing when their hair was cut, even if it has been washed since. If someone is being supported with personal care, carers often automatically try to be gentle and careful with their touch. However, if this is light, tickly touch, this can be the most difficult to tolerate. Firm, confident, deep pressure touch is much more calming. The best solution is often for the person to carry out the activity themselves. Transitions. So moving from one place to another or from one activity to another can be difficult. Different activities and places are likely to have different sensations, which can be unpredictable or unexpected. A person may have taken a while to settle down and be comfortable in one activity or place and then be expected to move to another. Sometimes the move between activities is stressful in itself, for example, walking down busy corridors or travelling on a bus. A change in plans means that the person then suddenly needs to gear themselves up for a different set of sensations and expectations. Change can be difficult, even if the change is a good one. People need the right sensory experiences and environment to be able to sleep. The room needs to be the right temperature with familiar and comfortable bedding. The amount and type of light is very important, as is the noise level. You can be woken up by loud snoring, a full bladder, an itch or restless legs, all of which are sensations. People need good awareness of sensations to be able to toilet effectively and neatly. Some people are less aware of the sensations of a full bowel or bladder, or not be aware that they are still dirty or have got feces on their hand. If they have difficulty coordinating their movements, they are less likely to be able to keep themselves clean. Some people also smear feces intentionally. This can be partly a sensory behaviour, as they might like the feel or the smell. These have been just a few examples of the difficulties that someone may have if they are having sensory processing difficulties. You may recognise some of these things that you do yourself, as well as some of the things that the person you care for does. If we've asked you to watch this video because you have concerns about someone you work with, or you yourself have difficulties, we will send you a link to a short questionnaire that you can fill in, which helps you understand what your difficulties might be. We'll then be able to send you some information that should be able to help you. We will also contact you about 1 month after we have sent the information to check how things are and if you have been able to try some of our suggestions. If you're still finding things difficult, we may be able to support or offer you in different ways. The information we send you will give you some ideas that you can try to help you or the person that you are caring for with sensory difficulties. This may be ways of developing acceptance of difficult sensory experiences or how to enhance sensory experience. There are suggestions of how to meet the need in appropriate ways. We may ask you to try activities, change a routine, or change something in the environment, such as the house or the centre. Please try some of these things over the next few weeks. There may not be sudden changes, but it might start to make a difference. Sometimes the biggest difference can be understanding what someone is experiencing and why they might be behaving the way they are. We hope this presentation has been helpful and thank you for listening.